Okay, thank you very much. Uh, on behalf of the complete Selco family, a very good afternoon, rather good evening to everybody, and welcome for this special webinar for the interaction with Mrs. Meenakshi Negi. Uh, for benefit of all the participants, I would like to give a brief introduction to today's guest speaker. So, Meenakshi Madam joined the Indian Forest Services in 1989 from the Karnataka cadre. She has done a BSc from Delhi University, MSc from Forestry from IGNFA Dehradun, MPhil in Public Policy from Indian Institute of Public Administration, New Delhi, and right now she is pursuing doctorate, that is PhD, from Institute of Social and Economic Change, Bangalore. She has come forward to support Bharatiya Vikas Trust in the work with ZP Chikmagalur on SHG federations using medicinal plants, cultivation, processing as livelihood. The project is in initial stages. Officers from the Medicinal Plants Authority of Karnataka will be extending all training and support for this. Otherwise, she is the Commissioner of Ayush, Department of Health and Family Welfare, Government of Karnataka. She is involved in the regulation of Ayush education, administration of service delivery, drug enforcement, industry issues, and implementation of the government schemes and programs. Prior to this, she was deputed to Government of India Ministry of Ayush for 8 years, out of which National Medicinal Plants Board, where she worked for 2 years, and proactively pursued with the state forest departments for taking up conservation projects with the state missions on cultivation projects representing NMPB on various committees like Planning Commission, NBA, etc. As an officer of the Indian Forest Services, she has handled different assignments like forest and wildlife protection, raising plantations of forestry species in the state of Karnataka, working closely with the Panchayat Raj institutions, watershed management, handling projects funded by foreign institutions, etc. Welcome, Meenakshi Madam. To join you on the panel is also our chairman, Dr. Harish Hande, and Sarah, who is the senior advisor with Selco Foundation. I welcome all of you. Over to you, Harish sir and Sarah Madam.
Good morning, ma'am. Thank you so much for accepting our invite into this, and thanks for working along with Bharatiya Vikas Trust. I just put on my video so we can actually see. Thanks so much, ma'am. Just to start off, ma'am, where do you think we are in terms of as a country? We do have a challenging thing forward in terms of our numbers, in terms of unlike other countries, which can easily talk about restrictions and everything. But our country is like completely from, we have extremely poor people to extremely rich people. It's not a homogeneous and from as being part of the government, I'm sure you have such a challenging, where do you see next 1 year from your own perspective, ma'am? And Sarah, please take over from me afterwards. Yeah.
Okay, I assume this is coming because of the COVID situation.
Yeah.
The question, what's going to happen?
Yes, ma'am. Yeah, this one to start with. Yes, ma'am.
Yeah, well, see, everybody is equally in the dark. Nobody knows the answer. Where will we want our heads? Okay.
Right.
In government, we're taking it like 1 day at a time because the pandemic is unfolding, as all of us know how it's unfolding. Everybody knows it. The numbers are increasing. But fortunately for us in India, at least in Karnataka, the death rate is under control. So our death rate is not so much. So that means the recoveries are faster and the recoveries are on the increase. So basically, the government's whole stance has shifted a bit to testing. Basically, the idea is that if you catch the disease early, recoveries will be faster. And how do you catch the disease early? By testing more and more. So now the whole focus of the government machinery, at least in Karnataka and even in other parts of the country, wherever the incidence is more in Delhi, Chennai and other places. So the focus is on testing now. So you catch the disease early in the sense you encourage people to report symptoms and then test them. And testing facilities have to increase. The private labs have been pulled into the picture. government testing facilities are all over the place. We are conducting rapid antigen tests and all that. So basically, if we are able to continue with that momentum, then I think we'll be able to, I think, carry on till there is vaccine or till as people are
Sure.
saying herd immunity, etc. So 1 year from now, I hope we'll be on top of the pandemic. That's the hope, and that's also, I think, possible. It's not impossible if we continue with this strategy.
So I don't know, ma'am, whether my colleagues were briefed you. We really, what we did also was, for us, I mean, Karnataka definitely is a easier state because of the infrastructure. So we did some interventions in East Garo Hills in Meghalaya, as well as outside of Patna, which has been interesting for multiple reasons. One is the population levels in terms of density is lower. But we've been able to do in East Garo with Swapnil, who is the DC of East Garo, and there because of some of the returning migrants, we put up quarantine centers. And quarantine centers powered by solar, because it's very remote, and Swapnil finds it very economically viable in the long run to look at decentralized renewable energy. So what he has done basically, he has decentralized all the health services, and saying that I don't need to rely on the grid in the future. Whatever I do in the quarantine centers, I can use it as maternal labor rooms in the future. So design of the hospitals and the PHC also has been relooked at, so that it's a long-term investment for the local DC. And that's how we've been able to have a health energy intervention in some of these tougher areas of Manipur and Meghalaya. So coming back, how do you see, for example, an NGO, the not-for-profits like Selco Foundation or BVT, to play a much more constructive role, working with complementing the efforts of the government? Where do you see that civil society's role?
Well, the civil society, of course, it is already partnering with government in several initiatives. In fact, the government is relying on in a big way on the volunteers who have come forward voluntarily to shore up the efforts of the government, whether it is in contact tracing, whether it is in testing, even sample collection now. Swab collection also, they are helping us. Then in setting up CCCs, for example, the COVID care centers we ourselves in the Ministry of Ayush, we are running several COVID care centers now. Most of our big hospitals have been converted into COVID care centers. Right. And many of the NGOs are partnering with us in supply of furniture, water, food, and various other, whatever we reach out for, they are there. So civil society certainly has, but this is not structured. In a way, it is not a structured exchange in the sense that as far as the COVID care centers are concerned, so they're coming in with various kinds of, for example, we have a COVID care center in one of our hospitals here in the Unani hospital in Bangalore. It's a big 200 bed facility. There they are providing us these cots made out of cardboard. So initially I was like, how can anybody sleep on a cardboard bed? It's going to collapse. But it's not collapsing. I mean, it's really good. So these kind of alternative materials and the different ideas that the NGOs are bringing in, that is good. But I think it needs to be, more of a structured involvement, in the sense that, for example, you might have heard of Apta Mitra. Have you heard of Apta Mitra? That is the COVID helpline of the government of Karnataka. And that is an example of how a structured partnership between industry and between the private sector and the government, including NGOs, how it can really be, how it can come together and create something which is of lasting value. Like you gave this example of Manipur. Here also, Apta Mitra is actually an example which you can hold out to the world. It's an example of how a very valuable asset can be created if government and private industry get together. This is of course government of Karnataka and private industry players under NASCOM basically. This is Infosys, AGS, Global Services, and Emphasis. These 4-5 companies, mainly led by Infosys, they have got together with the government of Karnataka, and we've set up this platform, Aktamitra, which is a helpline, and there is an app. You can download it, or you can call up 14410. That's the number of the helpline. And on a daily basis, we are receiving about, on an average, about 7,000, 6,000 calls. People who are symptomatic and want. So we have this is a telemedicine support. This is not just any other, it's not any other helpline where somebody will get to talk to somebody. Sometimes it doesn't connect. No, nothing of that sort. You actually get to speak to a doctor who will then advise you on how to go ahead and how to go forward. So there are many stories out there. Someday if it gets published, it will be such a wonderful. So this is the kind of structured interaction that I would say is the way forward for industry, NGOs, government, and everybody.
And before Sarah takes over,
yeah.
ma'am, and she'll not allow me to ask any more questions in the future, I will ask you, ma'am, is forestry to Ayush, how come? I know government places you everywhere, but because I have a related question to forestry. So how, first, from your perspective, forestry to this, how do you see it?
Actually, it was an accident, I could say. See, when you apply for Government of India postings, everybody is put in the same bucket. So they just pick you up from that bucket. So wherever you land. So this happened in 2007 when we applied for a Government of India posting. So I was picked up by the Ayush Ministry, and that's how it happens. So they just pick you up and then they say you have to join here. There's very little choice you have. So I was picked up and I didn't even know. I said, what is this Ayush? Where am I going? What is this? I had never heard of it also. 2007. So I went there, then I joined the ministry, then I came to know about the systems a bit. But I'm so glad today that I joined it because it's very close to forestry, and that is medicinal plants. And that's how I was invited to this talk. Basically, it is about medicinal plants. So, and prior to going to Government of India in 2007, I had been in the state for nearly 15 years. And in those 15 years, I had been to all the forests, seen all the forests, worked in the forests, wildlife areas. But I had never really looked at the little plants which were growing under the trees or by the side of the streams or climbing somewhere. I hadn't even looked at them. When I joined Ayush, I realized what a wealth of resource is available in the forest areas. And now I know for sure that that is the future of forestry also. You can always focus on the elephant and the tiger. Of course, nothing like focusing on the elephant and the tiger, because that is what grabs you the eyeballs, and that is what makes for good press, etc. But if you focus on these smaller plants, it takes care of the habitat in a much bigger way. So that is how it is. So that's how I landed here. And then when I came back to the state after 8 years, I expected to come back to forest and then do my bit. But then here also the government decided that since I had worked in Government of India, I should work here. So they literally kicking and screaming, I was put back.
So you know Mr. Vedant?
Yeah, I know. He is much senior, of course.
He was one of our first supporters, one way or the other, many years ago. When he also took over as the Karnataka, one of the few guys who actually realized the importance of Karnataka Renewable Energy Development Limited when it started in Karnataka. And so when Mr. Vedant was there, so he put us in the policy side of Credel many years ago. He was also, I don't know whether you briefly, unfortunately, Selco is known for solar, ma'am. Yeah. But the fact is, one of our major supporters, Good Energies, actually completely comes from the forestry background. In terms of Amazon, in terms of they are more on the Amazon side. They are a Dutch / Swiss NGO, which most looks at the inherent both the tribals, as well as the indigenous communities of Amazon, and the relationship between mankind and forest and the river Amazon, right? And that's why they were very interested in Selco's thought process. It was not about self-solar itself. The Selco's thought process of working with humans, with the nature, as well as sustainable energy, and how does true development actually take place. And that's why he pushes for, Johannes is a great forestry guy who leads Good Energies and has been looking at how do we integrate this in India, in a sense, what can Amazon learn from India and vice versa, in terms of both the relationship between forest, indigenous communities, and sustainable energy. So we'll come back to you on that a little separately with one-to-one meeting, ma'am, because that's for us is where our background is from.
That's actually a very, very interesting thing, because I am in fact doing a PhD currently, and that is exactly my title of my PhD.
Oh, is it?
Yeah, so it is basically livelihoods, medicine plants, and the institutional framework. So what is the institutional framework?
Oh, very nice. So I think Sarah, what I will do is also make ma'am is introduce you to Johannes, who he
Sure,
has, and
sure.
somebody who's been incredible. Who he's just that he is white, but he's brown inside. So as we see, as we keep saying, he's more Indian and Brazilian at heart, huh?
What's the name of the NGO? Not Amazon, correct?
Good Energy.
No, Good Energies Foundation.
Good Energies it's a small firm, but it pushes for a lot of the forestry, and saying that he's also done this whole mapping between the forests in Amazon to if you destroy a little bit more, and how the Congo forests are related and how the Indian monsoons are connected. So the way he maps it out in that manner, that every forest in this world is kind of connected right up to the Indonesian belt, and how the evaporation from Amazon actually does affect the Middle Africa as well as India. So somebody who would be very interesting to actually talk to. He's been our supporter for last 15 years from the forest spaces, and that's what. Sarah, please take over, because I've been taking.
Sure. No issues. Thank you, ma'am, for joining us. And of course, I think Harish sort of took away my initial question, because I think that is absolutely, I think, a very sort of interesting background. I think a trajectory of your background from forestry to medicinal plants, and I think that sort of is something that I think people don't tend to associate much or give much importance to. But it's wonderful, I think, to sort of hear, I think, your sort of journey and what has brought you to this point.
No, before Sarah, ma'am, Sarah's background is on monkeys, by the way. So
I have
her expertise is it.
I have a kindred, kind of shared interest as well, because I too have a more of an academic background in environmental science and forestry. So my work was around animal behavior, and of course, particularly around primates. But unfortunately, in captivity, and Harish sometimes will joke saying that I didn't make too much of a transition when I came from the zoo to Selco, but that's for another day. But ma'am, I think for me the almost the immediate connection, I think, is this sort of what we're seeing as a result of COVID. Some of our work is with, most of our work is in India, but we are also sort of expanding through local partners in parts of Africa, as well as parts of Southeast Asia. And what we're hearing from partners, as well as what we're seeing here as well, is this comeback or turning to sort of indigenous medicinal plants to boost immunity, to kind of combat COVID. And it's sort of this surge of this return to roots kind of a thing, to kind of tackle this issue. So I'm sort of curious as to, how have the priorities, have they changed significantly for Ayush pre-COVID and post-COVID? And are you seeing something sort of very, are you seeing a major shift? Are you seeing more interest? Is there a certain more strategic focus? Has COVID changed anything? So sort of this pre and post-COVID sort of focus on Ayush and medicines. I think just before I get into the other things, I think that's sort of been something that we're seeing as a comeback. And I apologize as well that my camera is giving me some issues, so I'm not able to turn that on. I apologize for that.
We would have liked to see you though.
I know. I mean, my audio and visual system is sort of, not set right. Sorry about that. Yes, please go ahead, ma'am.
So, see, now it's going to be, whatever I say is more of anecdotal evidence.
Sure.
It's too early to say with how, because that kind of data is not yet compiled. Maybe we will later, but Currently, we are still in the compilation stages. If at all we manage to compile it, it's going to take much longer because everybody is now fighting COVID and very little time for doing other things.
Right,
But
right.
one or two indications are there. For example, the price of medicinal plant material. Okay, just to give you a few figures, I had written it down somewhere. I'll just see the medicinal plants which were, for example, you had tulsi. Now, tulsi, you know, is like in India, it is everywhere.
Right.
Start your garden to your backyard to your potted plant everywhere. Huh? So, what was selling at 100 rupees kg pre-COVID, sometimes in January or end of last year, is today selling at 230, if at all it is available.
Right.
So the economy has gone in a tailspin, as you all know, and nobody is able to, like, whether it is farmers, whether it is industrial labor, whoever it may be, is suffering. But here are medicinal plant growers who are actually making a bonanza out of it.
Right,
So,
right.
from 100 rupees a kg within a month, it has jumped to 230 rupees a kg, and we are not getting supplies. So if you want to go out in the market and buy a 20 kgs of tulsi leaves for manufacturing something, you'll not find it. It's not available. Similarly, ashwagandha, which was 180 rupees kg prior to COVID, is now 580 rupees. Imagine. So, that is ashwagandha. And ashwagandha, as we all know, is an extremely good immunity booster, and not an immunity. It is a very, we say immunity boosting medicines because that is what the law is today. And,
right.
Name a cure, etc. All those things, all said and done. Ashwagandha is one thing which can really, deal with even. I'm very not. I won't say. I don't know. I don't think I have the. I don't have the permission to say that it can take care of critical patients, but I'm sure it can be tried on more critical. Currently, the protocol is that Ayush medicines should be given to asymptomatic or mild symptomatic. But in a few patients whom ashwagandha has been given to, have responded extremely well. Similarly, another medicine is this giloy, you might have heard, Amrita Balli in Kannada, and it's giloy in Hindi. Tinospora cordifolia is the name, Latin name. That also from 40 to 50 rupees a kg, today it is 150 rupees a kg.
Wow, right.
People are not leaving behind even a twig. Previously, what you like, pick up the choicest parts and let other things waste. Now everything is.
Absolutely, yeah.
Similarly, amla from 40 rupees to 200, not amla, Thailand. Then there is something known as Kalmeg, Andrographis paniculator. That also 50 rupees a kg to 200 rupees a kg, and so on. Even your lowly neem and everything is selling.
Right.
Is selling at 800 rupees a kg. So these are the. So if this is any indicator, which is a very good indicator, actually, you can see how people have actually. What can I say? Have realized the importance of for boosting their immunity or fighting COVID. So definitely COVID is going to be a game changer or a turning point in the history of history of medicinal plants in this country. Perhaps it's going to be like that because people have realized that this is the only way to. And people are very scared of the virus. People are very scared of going to hospitals. They don't want to. I mean, they would much rather try all these things and become better, and so on. So definitely, if this is any indication, which it is, it's as you said, as I said earlier, it's going to be a turning point. Apart from this, if you go for anecdotal evidence, we have one manufacturing facility here in government-owned manufacturing facility here in Bangalore. We manufacture some of these medicines. Okay, it belongs to the Department of Ayush, and it's called the Government Central Pharmacy, where we manufacture these products. And the moment it just goes off the shelf. We don't sell it, of course. It's free because we're not selling it. We're not charging anything for it. We manufacture it. It just flies off from our dispensaries. People are just waiting. They come to me with long letters of recommendation from different ministers. Please give us these medicines, etc. That is the kind of response.
Demand.
Demand is really increased. So putting together the empirical evidence and the anecdotal evidence, I think it's going to be a one.
Right.
Sadly, it took a COVID for us to realize it. But
Right. No, absolutely. Because I think, it's sort of, people are coming back with stories of going to hospitals and then they're being given wellness drinks, to combat, the side effects and even combat the disease itself. So I think, right.
Yeah, and even nobody has a medicine for it. No?
Correct.
There is no cure. There is no medicine. Everybody is only trying and testing things. So
Right.
this is a very. But
I mean, do you see, I mean, definitely, I completely agree with you. I think it's a turning point and India, I think a lot of people look at India, as one of those countries which is sort of blessed with an abundance of knowledge around some of our indigenous medicinal plants. And I think, when we often speak to some of our partners, they are talking of things like tulsi and neem and some of these medicinal plants that they are getting from their, importing. And I you mentioned this sort of surge and, sort of demand and I'm again, this sort of, segues into another sort of, theme that has kind of come through very strongly, which is around just the breakdown completely of livelihoods as a result of the pandemic. Putting many people on the street and sort of, making situations that were already very sort of precarious even worse. And now you have a situation where what we're seeing are also silver linings, where there are sort of livelihoods that are emerging from the pandemic as well, and people kind of, hooking on to certain opportunities. So I was sort of curious whether in this sort of, around this topic of medicinal plants, around this topic of, indigenous kind of, solutions, are you seeing any kind of, or what you feel are some of the opportunities that might emerge for livelihoods around this? Is there something that you are seeing in particular that could potentially, again, be a game changer for a previously maybe ignored or largely not looked at sort of space? So I'm just sort of curious what your thoughts were on that.
You summed it up well, actually. There is definitely, the issue is here about quality. Okay,
right.
Medicinal plants were being cultivated by some niche farmers. They were doing it. Some people were doing it for consumption on their own. Some people were doing it for selling in small quantities or large quantities. All that was there. But on quality was not so much. Now they're realizing that quality material is fetching a much higher price in the market. If I my own pharmacy, in the government pharmacy, if we have manufacture, so I go around looking for the best produce at the best price. I'm not really looking at the price so much as the quality, because if it is going to go into treatment of COVID people and if COVID patients, and if it is going to be a treatment for COVID, then I better be very sure that my quality is above.
You're right.
And that is happening with all the companies down the line. So, quality products. So this, I think, is going to be the single most important lesson which will come out of this, that farmers will now be invest in quality. Okay, whether it is traders, whoever it is, the entire supply chain has woken up to the quality aspect, which was not there previously. So going to be an important platform, and this is one single most important plan which Ayush are not getting the due they should be getting, because in the Western countries, the EU or Australia or Canada or any of these countries,
right,
they are very wary of importing our products because they're not sure of the quality, and our quality doesn't really meet those kinds of demands, their quality standards. But there are very simple issues which we don't do. It's not that our products are not good. It's only not
right.
raw material. The thing is that we don't do simple things like if I buy tulsi from the market and I want to make a product out of it, I want to sell it abroad, they will ask me, where did you get this tulsi from? Okay, and I can say I bought it from a shop, but that's not good enough for them. They need to know basically the traceability of the material.
Source, yeah, the traceability of it.
Some farmer in Ramnagar, for example, there is a tulsi cluster there. So if you can trace it to that and you have it on your label, and it is a transparent method by which anybody can see where the material was grown, whether it was organic, whether it was sustainable, whether it was connected to livelihoods, whether people were better off because of this tulsi which was grown on their lands. If this kind of information we can make it like a part of the product, then
Right.
it will not only fetch a premium for you, it will also increase the visibility of our systems in other countries and even in India. Indian consumers are not looking for cheap things.
Right.
They're also looking for good quality, even if they have to pay a rupee extra. And so that is one
Right.
point. So I think, I'm sorry, I lost track of the question basically.
No, not at all. I mean, in fact, my follow-up to that is, one of the things that Selco sort of is, the approach we take when we look at livelihoods is sometimes we look at it from, almost like a value chain approach, right? End to end, right from the source, all the way to its processed, kind of product. And we sort of seek to identify sort of the energy kind of intervention or the energy entry point for which we can, sort of improve, as you mentioned, sort of quality, for example, or, with the way this, the way it's transported or stored, for example, right, in terms of cold storage or things like that. So we try to identify the energy nodal points across this value chain. So you mentioned one of them in terms of the whole, the quality of the product and being able to kind of, attest to that. So I was just curious whether you see any other sort of entry points where energy can play a role, in the sense of, whether it's from drying, whether it's from cold storage. I mean, just given your understanding of the breadth of that entire value chain, right from identifying this plant to when it actually reaches your teacup or, your food. I mean, like, what would you kind of gauge are some of those entry points, or where you feel, because of not having, automating something, or maybe not having, kind of futurized a certain part of a processing, it has not really gone to a level that it should have. So just curious as to your thoughts, given your knowledge across that spectrum.
Yeah, that's right. In fact, it was the next argument which I was going to give.
Sure.
Quality. So what is quality? Quality,
Right.
First of all, it starts with identifying the right material. If it is tulsi, then it should be tulsi. But when you dry the leaves and powder it and you put it on, how can you tell whether it is tulsi or not? So,
right.
So where are the entry points you're asking?
Yes. Yeah.
So when the material is harvested, right from there, how they are harvesting it, what is the stage at which it is getting harvested, whether the right stage, the right time of harvest. The time of harvest is important. At what the crop it is harvested, right from bringing it from the field to the farmer's to the farmhouse, and then cleaning it, drying it, sorting it, grading it, fiber.
Right.
All those activities require energy. Definitely they need.
Right.
So what we are basically, see, these are small farmers. Now what we are trying to do is that we want farmers to get into this sector, into medicinal plants, not by putting all their holding into medicinal plants. So they should slowly, they shouldn't burn their fingers right in the beginning and then never look back.
Right.
So the idea is to put their marginal lands into medicine plant cultivation and continue with their regular crops. And when they realize the value of these crops from the marginal lands, they slowly shift to it. In the process, they get the knowledge, they understand how thing is done, because most of these medicine plants cultivation is new to the farmers. And it's easy to change attitudes. If I grow paddy for generations, I would rather grow paddy, even if it fetches me less money, because I'm sure of how to market it, where to go, where is the market, and etc.
Right.
Whereas the farmer, so if somebody could handhold the farmer in providing these low cost technologies, energy, not very energy intensive, it could be, and there are many examples all over the country. There is CMAP, there are many organizations who are working at these low cost technologies that very hygienic dryer or the storage,
Right.
moisture free and fungus free. These are minimum things, no? And how trade and dry. So at every stage, energy is required. The transport of the material itself is energy intensive.
Right.
So definitely there are entry points, especially at the farmer's doorstep. So what my own understanding is, and even the government schemes are like that you provide these facilities at the farmer's doorstep, not individual farmers, but maybe a cluster of farmers. And we common facilities, so that there is all-round sharing. They can share the common facility, use the common facility, and they will keep. I mean, the upkeep will be by them. So that is an intervention which would be very welcome at this stage. And in fact, in Chief Minister's Vikas, Bharat Vikas.
BBT.
Yeah, this is exactly the idea that we would like to take forward. If it fructifies, it would be. This is exactly the idea that you invest in not only with on the farmers' fields in terms of growing the crop, but also in terms of primary processing facilities. And simple hygienic facilities where they can process it, and where it will have a seal saying that from where it has originated, and then it can be sold to the industry. There can be a small testing facility locally, so that the material can be tested, stamped, sealed, and sold.
Right.
So that is the idea. So as I said, quality is important post-COVID, and how to maintain and improve quality is through these low-cost energy, low-cost systems of processing.
Sure.
And that's the idea.
Sure. No, so absolutely. I mean, I think this is, I was just taking down notes as well. I think the everything that you mentioned, right, from, the primary processing, cold storage, drying, I think there are several points of intervention, I would say, when we think of COVID care. I think it encompasses this as well, in terms of the whole medicinal plant aspect of COVID care. And I think the whole part of common facility centers, I mean, I think that's something which we have experience in doing. We've done it in the past, whether it's for textiles, whether it's for spice grinding, just definitely the sort of, it need not be individually. I mean, I think there are different combinations of ownership models that can happen. And certainly the common facility center is one of them. So I think we would be happy. I'm glad to hear that. I think that work is already is already happening, but I think certainly we would love to sort of even post this webinar, ma'am, sort of, get in touch with you and sort of understand where are the other sort of opportunities for us to, sort of play a role, whether it's a common facility center or whether there's any other sort of, site or somewhere where we can kind of look at this sort of end-to-end for medicinal plants as part of a COVID care kind of, strategy, even for us here at Selco. So that was sort of, helpful. And I think the whole livelihoods aspect of it and improving that and adding value to it, I think is a very sort of important step in this, because like you said, I think unfortunately or fortunately, it's become a turning point, the pandemic in many ways. And, I sort of just want to segue a little bit more broadly. I mean, like, I think, the whole medicinal plant aspect is, I think, one aspect of the entire healthcare system. And, when something like this hit, there was when the pandemic hit, there was almost like a frenzy of, not knowing what to do, how to handle it, how to cope with the situation, and it came from many quarters, right? Just from infrastructure, from public awareness, from broken supply chains, and not knowing what this disease was, in fact. It's not the first time I think disaster has touched our doorsteps, but this has been an unusual kind of disaster. Just curious if you, just for you to weigh in a little bit more broadly, I think on, if we were to look back a little bit, what would you say what would be some of your suggestions, I think, for a better prepared healthcare system for such disasters? Just more broadly, I think, is there anything that could have been done better looking back? We could have improved on and prepare ourselves, I think, for something else like this. I think this is hopefully one of the extreme ends of a disaster. Just curious, I think, from a more broad perspective, how do you think we can be better prepared from our healthcare systems?
Well, at this stage, looking back, so
right.
hindsight one can always, but some things we could have definitely done differently.
Right.
I don't know better or worse, but definitely we could have, and we have learned from here.
Right.
Beginning with the messaging itself. Okay. Beginning, the message that went out to the people was one which created panic. Okay. Interstate travel is stopped. All of a sudden, everything is stopped, and people are just stranded. They don't know where to go, what to do. So that messaging part itself. So the message that initially went from the highest levels to the lowest was one of panic.
Right.
There is something which has hit us, and I don't know whether we will live for tomorrow. That kind of panic hit people, and that's what led to those mass migrations, and
right.
That such heart-rending sights where people are migrating without knowing anything, away on foot, and with children and pregnant women and old people, and it was something which, should not have a place in any society, really, frankly. So I think that initial messaging part itself we went wrong. It should have been a more positive kind of message that, look, something has hit us, we do not know what it is, but don't worry, we are there to take care of you. That kind of message didn't go initially. So what happened was that there was this panic, and because of this panic, so many things happened which could have been avoided. So that is one thing which I would in hindsight do differently.
Right.
And second, of course, as usual, it's the same old story that we don't invest enough in these key sectors of health, education. We haven't invested over a period of all these years. It's just not enough for a country of our size to invest the kind of money we're investing in here.
Right.
So that is a lesson learned. And then all of a sudden, we had to divert all our resources towards health.
Right.
As a result of which the rest of the economy went into a tailspin. So these are two lessons which really are very important. But of course, now see, for a poor country like ours, a developing country with less resources, and it's very easy to say that we should invest more, but where does that investment come from? One. Secondly, how to get the private hospitals into, seeing eye to eye with the government. That took a long time. That took nearly 2-3 months to settle down, and they would come on board and all those kinds of things. So there should be more give and take. I think there should be more trust. There's a trust deficit between the private sector and the government at least.
Right.
All these things, and then the tendency of some people wanting to make a fast buck out of somebody else's misfortune. Of course, I don't know how that can ever change. That is just
human nature, right?
If you've seen monkeys, I'm sure you're much better.
They do. I think in nature you don't kill or you don't cheat for fun.
Somebody else's misfortune. You do
yeah, no, absolutely. I mean, that's the thing they say, like in nature, humans are the only species that sort of kills for fun. Everything else in nature, there's a purpose.
That brings me back to Ayush again, because That is where some wisdom we should be.
Right, right.
Those people have said all those years back what should be done, what should be your Ritucharya, Dinacharya, and what is known as Sadvrita. In our texts, Sadvrita is basically good behavior, good moral conduct. So if we were to really, connect to our roots, I'm not saying we should go back to mumbo jumbo or we should do some sacrificial, not that. But the moment you talk about these things, people take you back to those. It's not that. Look at the wisdom and the knowledge and how much Sadvrita can teach us. And in every meeting of mine, I have to say this word to whoever I'm meeting with, any of my subordinates or seniors. I said, look, all we need is good moral conduct. And
right.
That takes care of so many things which otherwise we won't do. And then as society, we can really go it. So basically, these are 2-3 things. One is, of course, messaging. Messaging has to be very positive. No matter what, from the highest levels, we cannot induce panic amongst people. Then second is investment, of course. And the third is a very meaningful partnership with private people.
Right. Okay, sure.
All of them are tension.
Parts of the
hospital beds were not available, and all these issues, and the media. Oh my God, the media will go, they'll go singing if one patient complains of no hospital bed, but they will not say anything if thousands of patients are. Okay, maybe the nature of the beast, we can't say anything, but we should. So these are 3-4 things which could have happened before.
Absolutely. Great. No, thanks, ma'am. In fact, before I let Harish sort of weigh in as well, I'm going to just take a few questions that have come, I think, appeared on some of the messages, and I think it's sort of centered around these themes of for young people, I think, who are trying to or maybe interested in getting into the space of Ayush or medicinal plants. Are there opportunities within the government for young entrepreneurs to get into this? Related to that question is, how do we, and maybe like you said, COVID is a turning point. So, there's more awareness, I think, that has happened as a result of this. We're sort of going past forward in many ways, right? So is there any, what would be your suggestions on generating or creating more awareness among young people in society around this? And this has come from Mohan Hegde sir as well, and BVT, 2 questions. So entrepreneurship and medicinal plants, what are the opportunities within government, and awareness among youth in schools? What can we do?
Yeah, right. So as far as entrepreneurship is concerned, I just put out a few figures. As on, I think, a couple of years back, the current market share of medicine plants and medicine plant products, that includes botanicals and pharmaceuticals, everything put together is about $62 billion US. Okay. And by 2050, it's going to be 5 trillion. That is what WHO says. 5 trillion US. Okay. The size of the cake out there.
Right.
Now, so if those are the market projections, and that is the current demand is also not less, and plus with COVID and everything put together, there is definitely a huge surge in the demand for pharmaceuticals based on medicine, basically phytopharmaceuticals and other botanical products, nutraceuticals and even cosmetics. Everybody safe and healthier and more natural options. So that is the size of the market out there. So any entrepreneur can just go take a look at what is the demand, but there needs to be some market intelligence around this. For any step into the sector, they need to know what is the market projection. For example, what happened with Safed Mostly, if you remember. I know if basically what had happened was Safed Mostly was this tuber, chlorophytum, which was cultivated in a big way in central India in those days. And some of the people made, very fast money out of that.
Right.
Everybody jumped onto the bandwagon. So what happened? Prices crashed, and farmers really burnt their fingers. So all those who were the initial pioneers in this sector made a huge profit. But those who got into it later didn't even get to harvest the crops. They had to basically just plow them back into the field because of the low demand later. More than market understanding, it has to be market intelligence which needs to be there. And like FedMaps, there is an organization called FedMaps. It's a traders federation, and there's an organization called FedMaps. These traders put together, and they take out these magazines. I think it's a quarterly or something, and they give market projections, and they tell you what is likely to be the market scenario for which product and which medicine plant in the future. Those are the kinds of, so if at all these entrepreneurs, the youngsters, they want to get into it, I think there is a big vacuum there for somebody who can do market intelligence.
Okay.
Data analysis, big data analysis, and talking to people and finding out what is the future prospects, and that basically it's a knowledge. Have the knowledge, you'll be able to guide others. So that is one sector where some people can easily get in, just projecting future demand for medicine plants. And the other, of course, is to manufacture. In the manufacturing sector, big opportunity. Now, what we need is more robust institutions for all this to come together. For example, now obviously there are some acts and rules by which you have to go if you want to get any sector, any manufacturing sector. Here also there are acts and rules. There's a Drugs and Cosmetics Act, rules, Magic Remedies Act, several rules and regulations. So what is happening is that the understanding of those rules and regulations by the people who enforce with the law itself is limited. What I mean by robust institutions is not only having a law, but the enforcement of that law should be equally robust and equally, what can I say, free of any extraneous pressures and extraneous, what can I say, incentives to people.
Right.
You apply the law in letter and spirit, and also in spirit more than the letter practically. And that is one capacity building which has to happen at the government level. Because if any of these youngsters were to approach any licensing authority, they would not know what's happening. It's such it's so opaque. Nobody knows where the license should, where to apply. So I am trying to put together, at least in Karnataka, we're trying to make it a very transparent process. We're making it an online this online service where people can apply, track the status of their licenses, where it is, what is the thing, and then possibly it will help them to understand that, because the licensing procedure itself is not very simple. There are several things which have to be understood by people. So I would ask anybody who wants to venture into this, that you look at the market, get into the right sector, whichever you want to, whether it is manufacturing, whether it is single drug manufacturing, whether it is classical drugs, whether you want to make extracts, because companies nowadays are just making extracts of 2 or 3 things and exporting all the extracts and making money. So you get into that, but you also understand the law first.
Okay, sure. Yeah. And are there any special schemes for this by the Ayush Ministry regarding I think encouraging entrepreneurship or livelihoods around this sort of medicinal plants? Is there any sort of support there?
Yes, there is, which I spoke to you about earlier, about
these
primary processing facilities.
Right.
Is subsidizing that activity. In fact, it's the subsidy is enough to actually build the entire facility.
Oh, is it? Okay.
Get together, form a special purpose vehicle, identify some land and their contribution, maybe in terms of land, labor, whatever. And it is for that, Government of India provides money. Government of India also provides money for cultivation of medicine plants, which are subsidized, and handsome subsidies. All those schemes are there.
Available. Okay, all right. Sure. So I'm conscious we have 5 minutes left. It's been wonderful talking to you, ma'am. I'm handing the baton over to Harish, for some, closing remarks or questions directed towards ma'am. But this was just, wonderful, I think, for you to share some of these insights and knowledge with us.
Thank you so much.
No, thanks. No, thanks, Sarah, for I don't know, you've not left anything for me to ask. But anyhow, but I will ask one thing to ma'am is that, ma'am, are you itching to go back to the forestry department? Or-
Yeah, well, I can't say because this is now finally, I think my heart belongs here. But without the forests, you can't have medicine. No
Absolutely.
matter how much you may into cultivation, no matter how much you may strive to get things into cultivation, we will still depend on the forests in a very big way because these medicinal plants have a very low, very narrow range, geographic, climatic. They are very niche species, most of them. So even if you can get a few into cultivation, out of 5,000 or some 8,000 species mentioned in the texts and folklore all combined together, how many can you cultivate? Not more than 200, max
Right.
500 maybe, but not more than that. So the rest of them we have to depend on the forest. So ultimately the forest areas have to be protected. They have to be what can I say? Be, they should be made more productive. Because as of now, there are several things plaguing the wild areas, as you very well know, biotic interference, then invasive species coming in, lantana, parthenium, and which is pushing out the native species, and so many other challenges are there. So definitely forests have to be, I mean, that is, I think, the bread and butter of the whole world for the future. Not only India, not only
What we would like to come back, I know we don't have time here, but we definitely want to come back to you, ma'am, one-to-one on a little bit from our side is, see, the positive side of COVID is that it leads to more democratization of opportunities, because we said that obviously we come from the solar spectre and say that decentralization, democratization of health and education, and more so, how do we create bubbles of 50 kilometers and 100 kilometers of market linkages that we decentralized livelihood opportunities rather than centralizing everything, and just like America losing out on that centralization that led to mass migration of jobs to China in terms of manufacturing. We have a chance not to do that. And COVID has actually further pushed that thought process. But more critically, the disturbing things that we get, ma'am, is that we get a call saying that X amount of families has been displaced from a forest. Why don't you put a mini grid? And the livelihood opportunities can we create, right, for these displaced families? But what happens is the livelihood opportunities are nowhere related to their past skill set. So we are de-skilling a lot of these people and saying that, okay, we are going to displace them. Let's do microgrid in the name of sustainability to this rehabilitated center and say, oh, let's do pottery making, something that's unrelated to. So those are things that I wanted to separately talk to you, because those are, whether it's Sundarbans, whether it is parts of upper parts of Karnataka, down to Maharashtra, a lot of solar is being used as a caveat for people, which is actually not correct. Solar itself might be sustainable, but where you deploy is unsustainable because you're actually taking out people from a different perspective. So that's a dangerous trend happening in our place, where we are looking at displaced communities with a livelihoods which is not connected to what their expertise was. And I wanted to have a little more solutions oriented. How do we bring in that aspect of thinking? No, let's not just blindly put livelihoods, something that it's an open-ended thing, ma'am. But that's a discussion I wanted to have, because we're getting, and we refuse those in many cases. We will not do it because it's not ethical for us to suddenly, your daughter has done engineering. No, now you have to do medical. We have a choice, but we don't give the poor the choice of what livelihoods they can do. So any thoughts on that, ma'am, and your closing comments?
I really don't know, because I think where you're coming from is displaced communities from forest areas, and then this, bringing them out of their habitats. Basically, that's what you're saying. Bring them out.
That's what they've been doing, yeah.
Yeah. So see, it has to be looked at in a very holistic manner, I think,
Right.
because if you want both to exist, if you want, these forests have dwindled to such an extent that maybe there is no other option but to move people out.
Right.
Or we think of a system where the people remain inside and yet they get all the benefits of modern day life. Is it possible? So what is the trade-off between
The balance.
now see, if a person is living in the center of some, is it correct to not? Is it correct that his children do not have access to WhatsApp or Facebook or computers or the latest technology? Just
Agree. Fair enough.
just because they were born to a poor tribal society. So that education, I think, see, all said and done, everything boils down to education. If we can somehow educate the younger generation. Now see, the older generation, whatever skill sets they have, we can, maybe we can see what skill sets they had. And but in Karnataka, that problem should not be so much because there aren't too many people who got this.
Not in Karnataka. Not in Karnataka. Absolutely.
Exactly. I know that because I was in Chikmagalur during our probation days, and we used to go to the Motoli forest, and I think some people were displaced from Motoli forest in Chikmagalur, and they were happily rehabilitated. So there wasn't such an issue because I think in Karnataka, education has been there for a long, long time as compared to other parts of the country where. So here people are more educated, even the tribals in remote areas. Very few remote pockets of tribals are left, I think, to my own understanding. And so that issue may not be there, but it's a very difficult question, frankly. It's a
The Brazilians ask us all the time, what do we do? Right? Like if we talk of indigenous communities in the Amazonian, and what are the solutions that some Indian forest officials have taken to make sure that the indigenous are not affected, and especially there, I mean, a lot of human contact has not happened, and so a lot of the questions come to us from that area also.
Yes, you're right, and I think we can look at options which are close to what they themselves are. But the younger generation has to be given a modern education. I mean, that's where the world is headed, and we cannot expect that they should continue in their hunting and gathering ways, and the rest of us.
They are scared because they're saying that. They're doing what? Every I don't know the latest figures are, every 4 months, the state of Karnataka is being eroded in Amazon. So they're going to reach the tipping point in 1 year, about point of no return, where the Amazon would have gone into unsustainability, the balance, the ecological balance between it. Anyway, thank you, ma'am, so much. We will have a longer conversation in your office. Thank you so much. Any last comments from your perspective, ma'am?
Well, what can I say except that I hope this is a very well put together talk, basically, because it touched at most of the points that I had thought would be touched upon as far as medicine plants, livelihoods, and so beginning with what the resources, but maybe a little bit more on what exactly are the uses of the medicine plants, where does it go?
Right.
So, people don't have the clarity. They think, okay, what can happen? Some churna can be made. Something in a bottle can be given, but no, it's got very, very varied applications, medicine plants. You'll be surprised to know that there is this Boswellia serrata. There is this gum. Gum is guar gum, not Boswellia, guar. Guar gum, which suddenly became one of the highest traded commodity from India. And then when we wanted to understand where it's going, we talked to this DGFT, and we found that it was being used in lubricating the oil drills in different parts of the world. So it was being used as a lubricant because it was much more superior to the normal grease or whatever they were using, the synthetic lubricant, because this wouldn't spoil in the water. And so these are the different kinds of applications that medicine plants have. It's not only medicines, pharmaceutical, nutraceuticals, cosmetics, industrial uses, so many uses, and very safe and better alternatives to synthetic materials. So that is perhaps one point which wasn't touched.
Right.
So with that,
Thank
hopefully,
thank you so much. Thank you, ma'am. We'll come and meet you in the office and take it forward, Sarah.
Yeah, absolutely. Thank you so much for your time and walking us through this unusual but very relevant topic.
Yeah, thank you everybody. Thank you, Meenakshi madam, Harish sir, Sarah. Just Balabhat sir that told me that you had made a presentation. So if you can share the presentation that that you wanted to present today, if it is ready, because we don't want to miss on any information that you wanted to give it to us.
Well, after that, I didn't really put the finishing touches to it because it was told that it's going to be a talk. So
okay, right.
I'll mail it across to you.
Yeah. Thank you so much, madam. Yeah, thank you. We will close the webinar here. Thank you very much, everybody.
Thank you so much. Thank you very much.